I'm gonna spread to your community. You do get me? Yeah, I'm going to spread my sickness to your community because you don't think you guys.
You're gonna, excuse me? Can you take a video? You're gonna do
I
what?
come collect my medication there.
You taking a video? You want to spread South Africa? What's your sickness?
Yeah.
The whole South Africa?
Yeah.
You're gonna spread?
I want dialogue.
You won't die alone.
With you. I'll start by your child first. I'll fuck up that one now. After let go.
My child? I don't have
I'll
children.
show you. I'll show you.
I don't have children.
Now, I have been observing the entitlement that undocumented foreigners have in South Africa, and I've been baffled as to where it comes from. They don't have entitlement in their own country of birth, but they have a lot of expectations of the South African government. Well, here is the reason for that.
In its latest cabinet sitting, Lesotho says it is worried about reports of Basotho being denied access to medical assistance and what seems to be random targeting and arrests of Lesotho citizens in the Republic.
Our appeal is that if you give a Lesotho citizen a visa to be in South Africa for a period of time, this Lesotho citizen would be in South Africa lawfully. That means that the citizen should access the health services because they are already in South Africa. Otherwise, what are we doing? Are we relegating them to death or what? So I think it's very important that if there are changes to, or rather, if there are conditions that we have to adhere to as the citizens who get the permits to be in South Africa, those conditions have to be clarified.
Morrissey says while she believes that this might not be an official policy of government, the messages implied is rather unsettling.
It's probably just xenophobic actions by South African citizens. What prompted that, I may not know. But I think the government of South Africa has to stop that immediately.
The government says it is in a process of sending a delegation to South Africa in an effort to find a solution to the recent and worrying
When it comes to
concerns.
discussing such issues, our neighboring countries always use a language of manipulation. Notice how Madam Minister did not mention that the healthcare that is being denied is the free healthcare that is provided by government hospitals. She didn't do that. Instead, she acted like Lesotho citizens were totally denied healthcare, which is not the case. They are welcome to go to private hospitals. The way she uses her words is very intentional. She's trying to paint South Africans as xenophobic. The Zimbabwean government also seems to think like this.
Now, the Zimbabwe Human Rights Commission is working with South Africa's public protector advocate Koleka to deal with complaints that Zimbabwean citizens are being turned away from public hospitals in the country. This comes after several reports showed that some hospitals are refusing to treat not only Zimbabweans, but indeed foreign nationals at large. The Zimbabwean government has also said it will not pay for its citizens to get medical help in South Africa.
I had no idea who our public protector was, so I had to Google her. I've inserted a picture of her. I also had no idea what her job description was, so I had to ask ChatGPT. According to ChatGPT, she's supposed to investigate the following: irregular awarding of tenders, nepotism in public hiring, delays in service delivery, corruption or fraud involving public funds, abuse of power by government officials. Everything I just mentioned is what she's supposed to be tending to. We have far too many communities in South Africa without bridges, schools without proper infrastructure, tenders being handed to family members, and so on. That is where her energy should be going. Instead, she spends her time and energy helping Zimbabweans abuse our already strained public health system.
I have to be frank and say that this is xenophobic in a lot of respects, because when a person presents themselves to a healthcare institution, they require services, and if they are of a particular nationality or are assumed to be of a particular nationality, they might not even be, by the way, then it's assumed that they don't deserve health care. So I, from the whole Ubuntu perspective, compassion and respect and dignity is what comes. And then sometimes you help a person and you ask questions later. So
Madam Minister from Zimbabwe just gave her opinion on the whole situation, and her solution is, help first, ask questions later. How is that a solution to anything? Evidently this woman doesn't care to solve the problem, and she doesn't feel the pain of a fellow third world country having to take care of people from all over the continent. She then uses the word Ubuntu. I find the usage of this word annoying. They like using this word and then claiming that other African nations did the same for South Africa during apartheid. That is not true. During apartheid, a maximum of 200 freedom fighters would be in exile at a time. They would only host a maximum of 200 people. Today, South Africa is expected to house and take care of millions of other Africans because they housed and took care of less than 200 freedom fighters. This is exploitation of the highest kind. Public health was created to be a service offered to the South Africans that cannot afford private healthcare. It was not created to be exploited by all of Southern Africa. Please let me know what you think in the comment section.